Cultural needs. There are different ways for a home health aide to recognize possible cultural differences in the home. The goal for every home health aide is always to provide the best care possible. It's difficult to provide this level of care if you don't understand how a person's culture or beliefs may impede or impact the delivery of care. Cultural differences are not always recognized. Sometimes a client is reluctant to share and do not mention them for fear that their belief may not be well received. A home health aide should always ask if there are any cultural concerns that they should be aware of and look for environmental cues that cultural needs may need to be addressed. Different people have different cultural needs. It might be different personal health beliefs and practices. Special foods and drinks, they could be vegan or vegetarian or kosher. Special objects, clothes, or religious items such as novenas, candles, relics, or lucky stones. Avoidance of certain people, places, and foods. The patient's beliefs regarding medications, medical procedures, or blood draws. Decision-making may be different. And customary rituals. How can a culture clash impact the delivery of home care? The individual's culture is the lens through which they view the world, and the healthcare world is not exempt. There are many different ways a culture can impact a client's access to care and ultimate compliance with care. Here are a few ways in which culture impacts the patient's view of their illness and care. A perception of illness and disease. Some individuals may not believe in the germ theory, and some may believe in chakras. Some may reject traditional medicine and want herbal or homeopathic treatments. Patients' understanding of body systems may impact the delivery of care. If they don't believe in the medical model, they will have a hard time believing the care provided by the system. The patient's understanding of the infective process will impact care. If they don't believe that they can spread infectious material, then they won't follow directions or take any precautions. Health-seeking behaviors can be either seeking treatment too often or not at all. There's certain expectations that people have of healthcare systems that may differ between cultures. Decision-making abilities may be different. Some individuals in certain cultures will let other people make their decisions, and this may not fit with your personal culture or frame of reference. Attitudes toward authorities can be very impactful. If a culture is distrustful of outsiders, they may not be very forthcoming about symptoms or seek treatment in time. Healthcare intersects three cultures: the caregiver's culture, or your culture, the healthcare culture itself, and the patient's culture. When cultural competence is a primary goal of the entire healthcare system, the patient's outcomes will improve. When a healthcare organization is culturally competent, the ability to interact effectively with culturally diverse patients and coworkers improves, and in turn, all of the outcomes improve.